Right. Can you hear me okay? Are we on? Sorry, I was chatting away there, forgot the time there, so I'll be as quick as I possibly can as people come through. Good afternoon. Hope you had a good morning and good lunch. I'm Andy King. New for me, I'm now a self-employed director of a consultancy until about 2 weeks ago when I was chief executive of Manchester Active, and prior to that, for a much longer period of time, I was chief executive of Your Trust in Rochdale, so an operator, to cut a long story short. But I'm also chair of GM Active, and you may have heard Greater Manchester mentioned a few times. So we're heavily involved in some of the good work that's going on in Greater Manchester, which I'll give you a little bit of an insight into today. But before we do that, I want to tell you a story, because you've just had lunch. I thought I'd tell you a quick story. Just to illustrate something that's relevant to what I'm going to talk about a bit later on. So this is John and Kirsty. They met at high school, young lovers, courted for 10 years. And on the evening that you can see John there tucking into his faggot, I think it might be, or a pie, he actually decided to finally propose to Kirsty, and Kirsty accepted, and they got married. So far, so good. 6 months into the marriage, Kirsty got a phone call. Kirsty was working at Salford Community Leisure, which might be a clue to some of you if you know some of this story. And she got a call from John that rushed to A&E in Manchester, and with pains down his left side and in his chest. So, of course, they're thinking, and Kirsty particularly being a fitness professional, was thinking, oh no, heart attack or stroke or something of that kind. They went in for tests, and a few days later, they got the phone call to go in to see the consultant. The good news, as Kirsty tells this story, was that it wasn't a heart attack or a stroke, but unfortunately it was cancer. Not long after that, I'm afraid to say, John passed away after 14 months or so of marriage. Why am I telling you this? I'm telling you this because Kirsty had only just started working in a can care, call it, in Salford Community Leisure, looking after patients who had cancer. And she thought she knew, in her words, what patients who had cancer were going through. She soon found out that that wasn't the case through looking after John for that short period of time and then getting more involved in the cancer community. Kirsty then decided that she didn't really like cancer very much, so she really wanted to create something and fight as best she can and help others to fight. I know sometimes people don't like the word fight, but that was her mindset, as you can probably understand. She now doesn't work for GM Active anymore, but she did, and she took the cancer care program in Salford to incredible levels. And you may have heard of Prehab for Cancer. It would not exist if Kirsty hadn't have done what she did, which was get involved, be the program manager, be a system leader in the true sense of the word, which we'll touch on later. And her passion and her desire and her purpose was to create something that was going to fight the fight against cancer in as many ways as possible. And I'll tell you a bit more about Prehab for Cancer later, because it's gone on to great things. But the point being is she knew her purpose, she made it happen, she joined people and places together, and she got to where we are now. And I'll tell you, as I say, a little bit more a bit later on. So what I'm going to do, a little bit of context. I'm going to talk about how leisure providers are adapting their approach to support the NHS. I will say, GM, you might go, not GM again. We're doing some good stuff, but we're also very, very conscious of lots of good stuff around the country. And I've just given up my day job, if you like, because I want to come to places like this and tell you all about things. But I also want to discover and help discover the really good practice that's going on in the country. And as Mike Farrar was saying, we need to scale this up. We need to find these things and scale them up. And we're doing a bit of that in GM, which we hope others can take from, get some inspiration or whatever. But equally, we get just as inspired by learning and hearing about other people's successes. And we need to do it. So I'll tell you a bit about that and the Prehab for Cancer. We'll have a look at pivot to active wellbeing, debate whether that's the right term or not, if you want. And then have a look at how do you start. So if you're interested, if you're a place, if you're a council, if you're an operator, if you're just a person who wants to do something, how does that work and what the next steps might be. So a bit of context, it's a bit doom and gloom, isn't it? In terms of closures, we've had COVID, we've had utility crises, all sorts of things going on. and now we've even got crumbling concrete. So it's not great. I think the point, though, is not to think about working with health because it might be the saviour of all our troubles and our woes and a big income stream. Go back to Kirsty. Kirsty didn't think about the income or the revenue for 1 second. It did not matter. Now, I can tell you the figures for pre-Alpha cancer as an example. There is a profit margin in there. It is going to help finances, but that cannot be our driver. It just can't, and we'll pick up on that later on. If you're interested, one of the things I put this manifesto for change was basically looking at the leisure sector, and it's slightly tongue-in-cheek, but I put this on LinkedIn and it got thousands of comments, and more to the point, it also got some, I got a phone call from the DCMS because of point 1. And I still believe in that, and I followed up a few weeks later with the objectives and the priorities of DCMS against the priorities of OHID, and I think it's very clear for me where we should be sat if we're really serious about that. So anyway, it's a debate. It's trying to be a little bit, poke the bear if you like. But there's another 15 there. So we can't just keep doing the same old things when you've looked at the context of the leisure centres. But that's slightly off what I'm talking about today. But happy to talk to anybody about any of that at any time. Still with the context, it's confusing, isn't it? Health are reorganising. Well, I'm old enough to have heard that so many times. It's untrue. But the opportunity for us is actually to be part of that partnership. So the P's in there are partnerships. We should be in there. We have to be in there. And we'll look about how we actually manage to do that. And I know some of you in the audience do and are getting some successes now, which is great. Now, I'm putting that, again, to be slightly controversial, because I think the argument about whether leisure, if you like, let's use that term, leisure, should be really focusing on what health and how we can work with health has been debated for some time. There's still one or two people. I sit on the UK Active Membership Council, and we sit alongside private sector, independent sector, public sector, outdoors ed, and all the rest of it. And we've looked at this in some detail, and it's quite interesting that actually everybody, all the different sectors, if you like, or parts of the sector, went off, had some debates, came back in after a couple of months, looking at the question of, like, do we have an appetite? And if so, how do we do this and all the rest of it? And every part of the sector said, to a different sort of variance of a degree, yes, we want to be involved. We want to be involved in this. We think it's the right thing to do. A couple of dissenting voices, that's fine, because not everybody sees their business in this way. That's absolutely fine. But I think as a sector, we really do need to figure out what our proposition is and what our purpose is. And if it is about working with health, then we really do need to look at ourselves honestly and say, well, it hasn't worked so far, with a few exceptions, some good exceptions, but at scale, it hasn't worked. So we've got to think differently, and we've got to do things differently. And again, I'll tell you a bit what we're doing in GM. Come on to that now. So GM Active is 12 operators across the 10 boroughs of Greater Manchester. It consists of approximately 3,500 staff, 99 leisure centres, a load of other staff that do outreach and stuff like that. So quite scalable. And we formed a few years ago now when devolution happened in 2015. I think I always get that wrong. I think it's 2015. And devolution happened, and basically the government said, EL Greater Manchester, here's a load of money, run your own affairs in some areas of health, right? Simple terms. So we thought, a few of us thought, maybe we should get together here and collaborate, and there might be some money in it for us. That was absolutely our mindset at the time. And funny enough, it didn't work. So for a good few years, absolutely nothing happened, apart from we had loads of meetings, and we managed to actually come together, share a bit of operational best practice, all that sort of malarkey, very much talking to ourselves. A little bit later on, a little bit of a change in personnel, change in attitudes has made a complete and utter change and difference. And that is down to what you might call now, we didn't know it at the time, system leadership, collaborative leadership, made a massive, massive difference. And we started to get some traction. We were in meetings with health colleagues at the highest level. Still won't get much out of it, to be honest, but we were there listening, learning, understanding what their needs were, not ours, theirs. And then we took it from there. Now, a little while ago, there was a COVID pandemic. You might remember it. And we thought, oh, bugger, we're in trouble here, because our centres were all closed, and we thought, we're going to be in trouble. This could be massive closures. And we even got Andy Burnham to come onto a call with us, and he was like, right, guys, tell us, how many centres are closing? I went, none at the moment. What? You've got me on a call and none are closing? No, afraid not. Not yet. We hope not, but they might do. So, well, when they are, do what Culture have done and show famous people in a blacked out auditorium going, you're taking our theatres and stuff away. And that was a bit of a learning for us, to be honest, in all seriousness, that like we hadn't played this right at all. It was another example of us thinking we're much more important to everybody than we actually were. And actually, we needed to learn from that and move on. Anyway, so we went to the Greater Manchester Combined Authority and said, look, we really do think we can contribute to the population health improvement. So please give us some help. We weren't asking for lots of money. We're just saying, look, we think we can do something here. We'd started with prehab. That had won an award from Andy Burnham. And we said, look, we want to build on that. There's loads more things that we can do. So we'd like to get your support. And luckily, they said, OK, we'll do that. And Sport England chipped in. So we got a little bit of money. We got about 200 and something thousand pounds to do a bit of work to see what is the art of the possible building on prehab. So prehab, as I've mentioned a good few times now, you'll see down the bottom, it's actually in 2022 won the Partnership Award with the HSJ Award. So a health gong, if you like. I think today we're just being, there's Judges' Houses for UK Active Award as well. So it's winning awards, but the most important thing is it's got an independent evaluation from the NHS, which is saying that basically people will make, as Mike Farrar was saying this morning, people will make a better recovery. They will get out of hospital beds between 1.5 and 2 nights sooner because they're fitter. So therefore, it saves the NHS money. So even though, as Mike was saying, the GM finances are just like everybody else's, not good, it's a good investment. The return has been proven. So we are now working at their request, GM Cancer's request, we're working on taking it from, initially it was 1,000 patients approximately a year. They want us to go up to 10,000 on the way to 20,000 patients just for prehab for cancer, to extend the cancer types that it's been included in the pathways for, but also to look at other long-term conditions as well. So the sky's the limit, to be honest, about as long as we can get the evaluation right. And again, that's something that we all need to be aware of. So the work streams on the pivot. So this bit of money, we're looking with GMCA and with Sport England, looking at the way we can move things on. So it's looking at things like physical assets. This will probably chime with anybody of the leisure operators in the audience. So traditional leisure centres, what would the physical assets need to be repurposed? What would they need to look like actually to be, let's call it a community wellbeing hub or centre? They do exist. We always trot out Alford Park in Great Sankey up in Warrington, Active Tameside's got Denton, Crewe have got some. They do exist, but not really at scale. So if we're really serious, we need to be thinking how our facilities need to be adapted. So we're doing some work on that. It isn't all about facilities, though. I stress, it is not all about facilities. Far from it. Just today, you've heard various people who've got nothing to do with facilities doing some fantastic work in this space, and we need to be making sure that we understand that and that we have plenty of opportunity to show what we can do, working with people on local pilot and other things. Parks, open spaces, you name it, blue and green spaces. We also need to get the evaluation right. So we're working with Salford University and others, looking about to try and find our next prehab for cancer. So they're looking at all the different programs that we currently do, and there are many of them for many different long-term conditions at a very small scale across Greater Manchester. We think this should happen nationally. I think it might have been Mike again said it this morning. So many good things going on, but we don't know about them. And they could be scaled. We don't have to keep reinventing the wheel, and that's where the collaboration and system leadership comes in again. So we're using quite a big chunk of our money to work with Salford to actually look at that for us, to look at the evaluation of each of those programs. How can we make that more robust? How can we get it so the NHS care about the evaluation, not some sort of, I don't know, for every pound spent, you get £4 back. Nobody believes that. It doesn't wash. So it might be true, but nobody believes it of any consequence. So we need to be understanding and learning what the evaluation needs to look like for the NHS and health partners to take us seriously. And that's how we're doing it. So I'll move on because I'm going on. The other thing we started some time ago was a GM Active college. This was our health subgroup and our people subgroup got together. And this is pre-pandemic, actually, when we were looking at, look, pre-ab, we knew was going to go through the roof. And our biggest problem, again, as mentioned this morning, was our workforce were not going to be up to the task. We're not going to have enough level 4 instructors, etc. But we also want to mobilise, if you like, the 3,500 staff in general to be the army that helps people be more physically active. So receptionists, cleaners, everybody, lifeguards, they need to know what our purpose is and what our mission is in life. And we did set up all sorts of things with our fantastic partners, FutureFit. They are brilliant, genuinely fantastic in terms of they're prepared to take a risk and work with you on this. So if you've got any workforce development stuff, I'd encourage you to talk to them. So we've got a range of programs on the digital platform, in particular, that can help upskill our workforce. The logic goes, we can't take, and remember this is before COVID, our logic then was we can't expect to go from one thing to another, a transformation, and expect our staff just to go along with it. We need to explain to them what that looks like, what it means. So there's a load of stuff going on there. We then created, very early on, the Transformational Leaders, which Andy Burnham kindly came along and presented the first cohort with their certificates and things and shook their hands. We've now, I think we're on about 80 now. Yeah, it says there, 80 leaders by the end of 2023. And that's something that is inspired was by the LGA Sport England Leadership Essentials programme I'd been on and one or two others, but also by some of the GM Moving, which we work very, very closely with now. Stuff on system leadership, whole systems and all the rest of it in collaborative leadership. A lot of it we thought was up here somewhere, wasn't really practical for our general managers, and so we decided to create our own programme, again with FutureFit. And that's just been great. And that has encouraged and inspired a lot of stuff, and there'll be a load of funding, we hope, coming out very soon nationally to actually work with different places to look at how we can transform at least the leaders to start with, and we would like to see the whole college approach, if you like, or an academy approach across our sector, if we're really serious about what we're trying to do. We're now looking at aspiring managers, so that sort of awkward level 3 duty manager. What do they need to know at the outset as they go through into their more senior careers? We think that it's really important this becomes the norm, that they look at how we can work collaboratively together. And we're also looking at the federal approach. How can we be more efficient? Again, people in the audience possibly from councils going, geez, that's all very well, but my service is hemorrhaging money. Well, we agree, and that's why we need to collaborate and actually make sure that we're doing the best we can with efficiencies, but we're not chucking the baby out with the bathwater. And that's what we can help with. And so that would be our key, all being well, that would be our key outcomes. And I haven't mentioned it yet, but tackling inequalities, again, part of our purpose as GM Active is very much about working together to share best practices about how we actually, a lot of talk about tackling inequalities, but how are we actually doing it? What are the prime examples? And to be honest, we're only starting on that journey, but it's something that we feel we should really collaborate on and do that as best we can. So how do you start? Here's a sales pitch. This is the company I work for now, Miova, something like that. And it's about system thinking, system change, and system leadership. I don't intend to try and take you all through it at the moment, but just to explain why it's different and why the evidence is very clear to me, and I'm sure to you, that our sector, if you like, gets left out all the time. We're not taken seriously by the government, by regional health people, by local health people often. We're just not seeing it. Again, there are some great examples, sort of proves the rule, really. And it's that, to be honest. We tend to think with our sporty background, I'm generalising, but we tend to have quite a sporty background, that it's a sort of winner takes all type approach, or it's a simple X causes Y. It just isn't. And again, I'm sure some of you come across all of this thinking before, but it's a complex problem. You know, best example I always think of is kids go into school, in primary school, and then they come out fatter. Fantastic. What a great job we're doing as a society, eh? What a load of rubbish. We really do need to take that seriously, don't we, and sort it out. But it's difficult. Nobody would want to see that happen, so why can't we sort it? It's a complex problem, but it's solvable, I think, if we all get our heads around this really complex approach, if you like, that needs to happen. So we bring the different parts of the system together, decide that we're really genuinely serious about it, and then we can sort it out. But until we get to that point, it's just something that goes, oh, it's too difficult, pal. We can't deal with that. And chaotic, I just think of a certain government not so long ago, say no more. So let's talk about that. So the leadership style, what's not working, the leadership style. So does it mean then, level 5 leadership, one of my 2 favourite all-time books, prize for anybody who knows where it's from? No? Jim Collins, Good to Great. Level 5 leader, still valid in terms of running an organisation. If you can be a level 5 leader, brilliant. Yeah, you're doing some really good work to lead an organisation. But we're talking about a different type of leadership. We're talking about a matrix management, if you like. We're talking about managing a system. And I go back to the GM Active approach, when very good, intelligent, experienced leaders were coming together, but we weren't getting anywhere. And I go back again to the approach that's being taken. The approach is, what's in it for me? What can I take out of it? On our scale, it's like, ooh, how much did culture get? We didn't get much. Ooh, let's have a word with them and try and get some more money out of that lot. We need to be taking a different approach. And again, I won't go all through this in great detail, but the co-creating number 5 is where we need to be. And it's interesting that's been said, Mike Fred said, we haven't got time to co-create. We need to be oven ready. We need to take things. I take a bit of issue with that. I think we can still co-create based on a template of what's happened in another place, but then you need to co-create with the locals, if you like, and make it fit, or find out it doesn't fit in a place. So I think there's a subtlety to that, but I think it's important that we don't lose sight of that. So again, there's different ways of doing this. The management systems leadership. So I think I'm probably flogging this to the point where you can get the picture if you haven't seen this before. So ordinary management, even if you're a brilliant manager, running one organisation is not the same as collaborative systems leadership across a place. It just isn't. And we need to understand that. Our managers need to understand that. And some of our transformational leadership, you'll see our general managers who were all about swimming lessons and fitness memberships. They still do that, and the team do that, but then they're going, I'm putting some time aside in my week to go and make connections with the local. I need to know who they are first, some system mapping. They get the telephone directory out. Don't do that anymore, do they? But they do whatever they do to find them, and they go seek them out, and they invite them to collaborate and come as a system. And there's some brilliant stories. And I should say, all of our 80 managers who go through the transformational leadership, they get charged with doing a 100-day plan at the end, and they all have to put their learning into this 100-day plan. And some of those stories, honestly, are fantastic, of the change of mindset and then the practicalities of this being applied is absolutely incredible. And then this is sort of going through a bit more of that. I want to try and leave some time for questions, so I'm going to go on to this. And this is some of the co-creation. So some real principles here of how this works. People owning what they create. You can read it. I don't need to read it out for yourself. I think the thing here, though, is that you've got to start somewhere, and you don't wait for somebody else to kick it off. You've got to make this happen. So if you're at whatever level you're at in an organisation, you can make this happen. And again, we've got some fantastic examples of general managers, and even, if you like, below a general manager, going on our transformational leadership, going back to base, because this is a GM thing. They go back to their leaders, if you like, their bosses, and they're going, hang on, you need to get up to speed with this, mate. You know, we're moving on. I'm making contact with these local connections. You need to understand why I'm doing that. So again, you can get the picture. And this is where we tend to be. I used to work until recently, I was Northern Regional Director for one of the largest leisure operator, and they had that centralised thing, and it used to drive me nuts because, you know, London knew best, if you like. I've just given you a clue. And they just don't, or if it's in the regional area, GM knows best. No, they don't. It needs to be more of a decentralised and ideally distributed, so we're all learning from each other. Everything we've talked about is co-creation, collaboration, share best ideas, best practice, and go on from there. And a little bit of thought, if we're serious about working with the NHS, it boils me when I read that barbershops are going to be asked to do things that we could be doing. There's a weight loss jab, and they're going, the NHS haven't got enough staff to do it. And then some of my colleagues, and I understand well, we shouldn't be anywhere near that. Well, yeah, we should, I think. I think our staff, our workforce, should be part of what the NHS decide needs to happen. And then once they're in our grasp, if you like, our sales background can kick in, and we can actually then upsell them physical activity. Happy days. Come on. And this is another one of mine, the Diabetes Prevention Programme. Great hearing about Diabetes UK earlier, but the prevention programme goes on all around us, major sums of money, and if we're lucky, our total sum involvement in that is we might hire them a space to actually hold their meetings. We've got to do better than that. So in summary, know your why, know your purpose as an individual, as a company, as a sector, and be more Kirsty. You can clap now.